Yes, doctor.
All right. So I have put it down normal drugs that are commonly available drugs. It was developed from the last batch, and you can also add some of the medications if you want to. So first here, aspirin. What is the dose of the aspirin? 75 milligram. This is the strength. The aspirin available in 75 milligram, 81 milligram, and 100 milligrams. You prescribe these medications as once daily. All right. So let me put it in another way. Okay. So these are the list of medications that you probably would like to encounter. Okay, if I ask you amoxicillin, these are all the drugs that you probably have an idea. Amoxicillin it is available in tablets, it is available in syrup form. What do you think amoxicillin? What is the strength of the amoxicillin? In milligrams. What is the strength? Mg. What are the different strengths of the amoxicillin available in the market? Do you have an idea?
Start from 100
100
milligrams.
milligrams.
Maybe.
And does anyone
400.
Have taken amoxicillin as an adult patient? You guys haven't taken amoxicillin into your whole life? What
Or 250.
Huh?
250.
250. That's great. All right. The one strength is 250 milligrams. The other strength is
500.
500.
500 milligram. Yes. Okay. So I'm talking about adults. Augmentin. Augmentin is, yeah. Augmentin, by the way, Augmentin is a combination of
Amoxicillin and the clavulanic acid.
clavulanic acid. Okay. So it is available. What are the strengths of Augmentin? You can also use your mobile and see what is the strengths available.
1 gram.
1 gram. Okay. If you wanted to use that high, if you want to go a little downwards, how much?
500 also.
500. 500 is an amoxicillin. Actually, it comes in 625 milligrams, which includes 500 amoxicillin and 125 of clavulanic acid. So 625, 375. So these are the true strengths that are available. Amoxicillin and Augmentin, how frequently you give to the patient? Any BID, TID, once daily? What do you think?
TID.
TID, yes. Usually given TID, but if you are using high doses of Augmentin like 1 gram, you should use it BID, but generally speaking TID. So 3 times daily. Amoxicillin, also TID. Azithromycin. The strength of the azithromycin in adults, tablets only.
250 and 500, both.
Okay. Okay, Cefixime. What is the strength? And azithromycin, how frequently you give? Once daily or twice daily?
Once daily.
Once daily. Great. Cefixime, once daily or twice daily?
Twice daily.
Yes, twice.
Only once.
Usually once daily. Cefixime, what is the strength of Cefixime in adults? I'm talking about only adults up till for now. Cefixime, you will give once daily or twice daily? You can make a guess, no problem. You guys
Once.
you guys don't use medications on your own? Okay. So Cefixime usually gives once daily. Metronidazole gives TID. Ciprofloxacin gives you should give BID. Paracetamol, okay. Paracetamol, how frequently you can give?
Every
Up
4
to
hours, 2
every
tablets.
4 hours.
Okay, Q4 hourly or Q6 hourly can be given. Paracetamol strength
500
500
milligram.
milligrams. Okay. So ibuprofen 400 milligrams. It is spaced out by Q6 hourly. Aspirin we discussed 75 milligram and gives once daily. Omeprazole for the PPIs 20 milligram, 40 milligrams. Cetirizine antiallergics, usually in antiallergics for cetirizine you don't have any mgs attached to it. Okay, so these are general medications, some of the antibiotics. Now you come on to the hypertensive medications. Lisinopril is an ACE inhibitor. Okay, given once daily. Amlodipine is a calcium channel blocker. 5 milligram or 10 milligram, usually give once daily. Simvastatin 20 milligram, 40 milligram, usually given once daily. For the diabetes, you can also search it in the internet. They're all standardized, so you don't need, but the only point here is that whatever medications are listed here, I think you should have an idea of what are the strengths, what are the frequencies. Not all of the medications you are required to remember, but obviously the drugs that are mentioned here, I would expect you guys to remember the medication name, their strength, their frequency, how do they take it, what are the side effects, things like that. Diabetes, for the diabetes, metformin is 500 milligram or 1 gram. Insulin, we will discuss a little for later on in a detail. Glyphoside, this is a sulfonyl urease. For hypothyroidism, you give thyroxine. This is in micrograms, 500 microgram mcg. So you will write down this microgram, not that 0.5 gram, not like this. For asthma, salbutamol, salbutrol, ibuprofen, ipratropiamide, these are all inhaler forms. So you need to write down that this is an inhaler form that you're using it. Fluticasone, this is a steroid inhaler. Prednisolone, this is an oral steroid for the asthma care. Okay, if you see here, I've written down the strengths. Amoxicillin available in 250, 500, Augmentin 375, 625, given BID or TID. Common side effect, amoxicillin and the Augmentin is diarrhea. Okay, this is the common side effect of this medication. So whenever you are prescribing the patient, counsel them that you may have some GI disturbances. You can take some probiotics with it, or you can take it with meals, or you can take it after, you can take it and with yogurts. So this is the in order to reduce these side effects. Azithromycin, as we discussed, 250 milligram and 500 milligrams. I will come for the children's. I will come later on. Cefixime, available Cefspan, 400 milligrams once daily. Ciprofloxacin, 400 milligrams BID. Paracetamol for 500 milligrams TID or QID. Ibuprofen 400 milligrams BID or TID. Aspirin available in 81 milligrams, 75 milligrams once daily. Omeprazole 20, 40 milligrams once daily. Here it is also written, you should also write down or explain that it should be given before meal. Cetirizine HS at night. There is another anti-allergic that you, what are the anti-allergics that you guys have used it? You are known to what is, whether is it a trade name or a generic name, what anti-allergy you guys use it? Yeah, you know it, or you know about it. Anti-allergic, which anti-allergic you know?
Antihistamine.
Antihistamine.
Clarinase, doctor.
Clarinase, okay. What is in it? Clarinase. What is present in clarinase? Do you know?
Histamine.
Yeah, antihistamine is clarinase is a generic name or a trade name. You are aware of generic name and trade name? Yeah, what is it?
The trade name is the marketing name for
Mark is the commercial name of the company name. All right, the drug name. The chemical in it is a generic name. Okay, cetirizine here is a generic name, not a company name. You are saying antihistamine. Antihistamine is a category of that generic actually, so it's not a drug name. Clarinase. What is present in clarinase?
Loratadine.
Loratadine. All right, so loratadine. All right, and you usually in antihistamines or anti-allergics there is drowsiness attached to it. What is the strength of loratadine or clarinase? You can take you can take your mobile and search clarinase.
doctor. I guess it says like it doesn't cause sleep, so like
Okay, yes,
this would give a hunch of good.
yes, good. All right. Usually they however it is not true for every patient. They claim that okay, this is a non-sedating anti-allergic. But still the some patients have this if the patient is very sensitive and he did not take these medications, anti-allergic medications, not so frequently, even that patient can have some kind of sedation, although it is written non-sedating. All right, so it can be given once daily, BID or TID, both. All right, and you can look up the strength also. So okay, now we go to the hypertension. Lisinopril ACE inhibitor 5 milligram once daily. Common side effect for ACE inhibitor, dry cough, right? Amlodipine 5 milligram 10 milligram once daily or BID. The common side effect is edema. All right, so whenever the patient is you're prescribing the medication, you need to also explain these common side effects, or you can expect these side effects from the patient. Simvastatin 40 milligram or 80 milligrams once daily, and it is not common, but it is very severe rhabdomyolysis. Be aware of this. It's not a common condition, but it can have this. So how do you diagnose this rhabdomyolysis? If you prescribe a patient with simvastatin and he comes to you after 1 week and you are suspecting rhabdomyolysis, what is the symptom that the patient may have?
Muscle cramps.
Muscle cramps or muscle tendon or muscle cramps with an increased intensity, extreme myalgias. Okay, then you can suspect okay, the patient may have suffering from rhabdomyolysis. So what you will do, you will stop the medication. What investigation you are going to do in order to diagnose rhabdomyolysis?
Urine analysis,
Urine analysis. What will come in the urine analysis?
RBCs.
Myoglobinuria.
Myoglobinuria. Okay, yes, myoglobinuria. All right, so for the diabetes, we use it metformin, sulfonylureas, glipizide 5 milligram once daily before meals. Sulfonylureas, common side effect of sulfonylureas, glipizide is a sulfonylureas. Okay, common side effect is, it is not written here. Common side effect of sulfonylureas.
Hypoglycemia.
Hypoglycemia, yes. All right. Metformin, common side effects is GI disturbance, or you can say abdominal. GI disturbances include abdominal cramp, abdominal discomfort, maybe diarrhea if it is using for the first time. Now insulin. regardless of, first you need to know for hypothyroidism you use thyroxine, and it is 500 mcg once daily, and it is also given before meals or empty stomach to make it more more effective. Okay, now we come on to the insulin. How are you going to calculate the insulin doses? Insulin, no matter is it a long, if you decided to a patient who is diabetic and wants to start off with the medications, you will start with the insulin. No matter what kind of insulin you are going to target, you first need to calculate the amount which is required for the insulin. So here, the usually starting dose is 0.25 unit to 0.5 unit per kg per day. Okay, so if the patient is 80 kilograms, what is the insulin regimen for that day? If you divide it, if you multiply it 0.25 milligram, then it will, your answer is 20 unit. Okay, so if you divide, for the sake of simplicity, 0.5 unit, if you want to start off with high, then you can keep it half. So if the patient is 80 kilogram, the dose is 40 units per day. But if you're doing it 0.25, the unit will become 20 unit per day. This is the requirement, basic requirement of the insulin. So how you want to give to the insulin? If I talk about intermediate and intermediate acting, you give 2/3 in the morning and 1/3 in the night. So we calculated 20 unit. We will divide 2/3, approximately 15 unit in the morning, and 1/3 at night, 5 unit in the afternoon. So then you can you ask the patient to monitor the sugar levels, and then see how the sugar levels are going, and then you can tailor this. This is the starting point. This is how you are starting a patient with insulin. After the patient comes to you, then you can readjust the doses of insulin based on what are the FBS, what are the RBS. Okay, let me ask you first. You start this patient with this 15 unit and 5 unit, 15 unit in the morning and 5 unit in the afternoon. Then what you say is you will ask the patient to follow with RBS. That is, RBS is what?
Random blood sugar.
Random blood sugar. Random blood sugar means an FBS. Random blood sugar means
Anytime, doctor.
anytime, yeah. But if I want to, by definition, random blood sugar is for after how long with after meals? How long after meals? Usually
2
2
hours.
hours.
2 hours. So 2 hours. 2 hours post meal. Okay, usually. Fasting is before breakfast, or 8 hours of fasting, usually 8 to 10 hours minimum, or you can increase up to 14 hours, but usually minimum 8 to 10 hours fasting. All right, and then you ask the patient to monitor his FBS. Okay, remember that the patient you started off with the patient 15 unit in the morning and 5 unit in the afternoon. We are talking about intermediate insulins. The patient's FBS, what is the target of let's discuss the target first. The target of the patient who is on already diabetic. What is the ideal for this patient to maintain the target of the
Less
FBS?
than 100.
Less than 100. No, the target is less than 130 actually milligram per deciliter. Okay, this is the target for you to maintain it. 100, it's okay, it's also acceptable, but even 130 is also not bad. For the RBS, the target is 150 to 180 milligram per deciliter. Okay. Now, if you say, now you ask the patient to monitor his sugar levels. Okay. And the sugar levels are you are getting sugar levels of fasting are getting 180 or 200, or if sometimes 250. So is it controlled or not controlled?
Not controlled.
Not controlled. Okay. When you see this problem, you start the patient with 15 unit in the morning and 5 unit in the afternoon, and then you getting this these high levels. Then how are you going to? It requires increase insulin dose, right? We require to increase insulin, right or not?
Yes.
Right. Okay. So now, which dose you are going to increase, in the morning or in the night?
The night,
Ah, okay.
because it's fasting.
Mm-hmm.
Yeah, even after fasting, his glucose is high, so the
Even
night
after
dose is not
fast.
enough because he's supposed to be sleeping at night.
Mm-hmm. Mm-hmm. Good. Yes. Actually, this is the thing. If you are getting morning high sugars, you will increase here. And this is your clinical judgment. You can increase by 2. You usually, what is the algorithm you follow? You follow that you can increase 2 units per day to see the response. You will ask the patient, okay, now since your fasting is high, you need to increase your night dose, one dose before it, so that it can control your fasting. So you will increase the night dose in order to target your fasting sugars. So you can ask the patient to you need to increase by 2 units, then wait for 2 days, then see what are the responses of FBS, then increase 2 unit further, then you can see the FBS rate, so on and so forth. You will begin from this. Okay. And same way, if the patient has 2 hours for say at night, so if you have at night RBS of 300, 250, 200, so these are all high. All right. So you will target which dose you will increase, morning or night dose? This is this is after the dinner. After dinner, 2 hours after dinner, you are getting this these sugar levels. You are going to what will you do? You will increase which dose?
Morning.
Morning dose. Okay, you will further increase 2 doses of maybe 15 is taking. You can increase it to 17 unit, and then 2 units further, and then 2 units further. So we discussed this 2 regime package. If you have if the patient is on 3 regime package, like intermediate and if the patient is using a combination of intermediate and short acting insulin pens, and you giving the patient TID doses, then if the post meal is, if the patient is having this, then you need to see what is the time of this high levels, if it is in the afternoon or if it is in the dinner, yani post lunch or post dinner. If it is, if you are getting post dinner highs, then you will target the middle dose of the insulin if the patient is getting in the middle. If you are getting post lunch high, you will target the morning dose in order to control the post lunch or post lunch sugars. So specifically target the specific time of the of the sugar levels. So you need to target the specific day of that dose of that insulin you are giving to the patient. So that's all about the principles of insulin. How are you going to manage these patients? Is this clear?
Doctor,
Yes.
can you repeat the point of intermediate and